Marketing is an interesting function and discipline because on one hand, and you have people that are responsible for elements of marketing like advertising, like trade shows or events, like content generation. They might be doing marketing automations, right? Integration with Salesforce and making sure that they understand the funnel, top funnel, and all the requirements that come along with that role. You have sales enablement, which can be part of sales, can be part of marketing. Product marketing, which is very different. Marcom or marketing communications, right? And so it's a really interesting discipline. And quite frankly, most people don't understand it.
Hey guys, welcome to the Grow IT podcast. Your host here, Alessandro Cutri, joined today by none other than the Ed Gaudet. We'll be diving into his story, a little bit about his company, Censinet, and much more insights into the cybersecurity space. So definitely make sure to stick around. This one's going to be a fun one. But without further ado, I'll just kick it on over to you, Ed, if you don't mind just introducing yourself and telling the audience a little bit about your story and kind of how you got to where you are today.
Yes, I'm Ed Gaudet for my French friends and Gaudet for my American friends. It's a pleasure to be here. I am the CEO and founder of a company called Censinet. We are focused on risk management in healthcare, and I'll tell you more about that as we go through the program. But really interesting space, interesting industry, and a lot going on in cybersecurity and risk management today. So lot to cover.
Definitely,
Um,
definitely.
yeah.
Yeah, and so I just wanted to maybe, start with like how you got into. I mean, I always like to
Yeah.
say entrepreneur people who start
Yeah.
companies, they're a little bit crazy, right? They got a
Yeah.
little
Very crazy.
something wrong with them.
Yeah. Oh, yeah.
But what
So,
what was it that prompted you to want to, go and start? I see you guys you've been in business now for about 8 years. Like, what was it that started that entrepreneurial
yeah.
spirit and led you down that path?
Well, it's a really good question. Again, I think a lot of what we do starts with our childhood and those experiences we've had.
Mm-hmm.
Um, and so I worked at an early age. My family, very modest. My dad was blue collar machinist, worked for a union UAW group that made ball bearings for
Mm-hmm.
cars.
Yeah.
And so, if you wanted something, you had to go earn it. And
Yeah.
first job out of 9 years old, caddy for golfers, carry bags for
Yeah.
36 holes. And
Yeah.
just, I mean, I've probably had, I don't know, by the time I was 18, I probably had 30 jobs.
Wow.
Dishwashing. I worked at a mink farm. I
Mm-hmm.
worked at a lobster in fish market, unloading trucks, midnight to 8 a.m.
Yeah.
I sold everything. I had multiple paper routes. So I think that entrepreneurial spirit is sort of formed at an early age. And then my first job out of school I was fortunate. I was a technical writer,
Yeah.
believe it or not. And I was introduced to a CEO at a startup who wanted someone to help with documenting the functionality of the application. And a
Uh-huh.
year later, I'm running marketing and sales internationally, and I'm making it up as I go along. So
Yeah.
I definitely, like everyone else, I'm sure at an early age, was struggling with that imposter complex, right,
Hmm.
or syndrome.
Hmm.
But very fortunate to work with just amazing people throughout my career that, great leaders, great mentors,
Yeah.
really helped me. I'm an autodidact, so if I didn't know, I would read about it and figure it out on my own.
Yeah.
So quickly learned how to create products and quickly learned the life cycle of a startup, basically from cradle to grave. And usually that grave, ended up in some type of liquidity event or
Yeah.
exit.
Yeah.
So
Yeah. Yeah. Yeah.
yeah, yeah.
That's
So 11 companies later
yeah.
started Censinet in September of 2017.
That's awesome, man. Right. And it's funny how, to your point, right? Like there's certain things that you do throughout your life that almost prime you to be an entrepreneur at some point or another, right? And
Yes,
I love the
exactly.
fact that you brought up working at a young age and those experiences, being able to kind of shape you because I feel like that's very relatable with myself. I grew up in an Italian restaurant working as a kid and
There you
started
go.
my dad put me to work at like 10 years old, right? And I would tell my third grade teacher to come visit me at the restaurant. And so I can relate, right? It's
Mm.
almost that it's ingrained in you in a sense, right? Where it kind of comes very naturally. And I think that that's the beautiful thing about starting to work as a young boy, right? Um, but that's awesome. Obviously we talked a little bit about kind of that transition. Just for the audience that doesn't know, like that is kind of tuning into the first time, maybe they're hearing about Censinet, like what you guys do. Could you kind of just give a little bit about like your value proposition, what you guys
Yeah,
do as an organization, and kind of where you would say
yeah,
maybe you
sure.
stand out?
So when healthcare organizations, health systems, hospitals acquire products, goods or services,
Mhm.
um, and mostly those that are technical in nature, whether it be software or medical devices or anything in between,
Yeah.
they go through a process to assess the risk of
Hmm.
those products, and that process is largely manual in nature. It exists with spreadsheets and phone calls and emails, and it's a very inefficient process. Can take anywhere from 44 days or longer. We did some early research, and so and usually it's done by risk assessors, and again based on the volume, you scale linearly with the number of bodies that you hire. So again, it's a pretty costly, a, a costly requirement for these organizations. And so
Hmm.
what we saw, and we were on the other end of it. This was a previous company, Censinet. We had to marshal these security risk assessments through the
Mm.
process in order to sell to hospitals and health systems, and that was our primary market. So I kept coming back to there's got to be a better way.
Yeah.
We get no leverage. We see one. They're all different. Every process is different. Every format's different. Every question's different. So I took all that learning and went out and uh, created a design program with about a dozen or so providers and said, what does it look like on your end? What are the
Hmm.
challenges you're facing in this process? I know
Hmm.
it's largely manual and on your end as well, but like, what do the workflows look like? Who are the individuals involved in the
Yeah.
organization other than just the security people? And it was get some really fascinating data back, and then began to build out a platform to really, number one, make that process much more efficient, automate that
Yeah.
process from an end-to-end perspective, and do it in a way that you could get leverage from the community. And what I mean by that is we're all sort of doing it. We're all leveraging the same goods and services. And is why do we keep duplicating efforts? Is there a way that we can get leverage based on the work that maybe a vendor does for one provider for the next provider or the next N number of providers?
Yeah.
So we created this concept of a two-sided network where
Hmm.
we connected the health systems, the CISOs and their security teams, with their third-party vendors. And we started to facilitate risk across that network.
Hmm.
And we do it. So think about a marketplace like Amazon, but purpose built for risk management.
Hmm.
And then we took that and we began to explore other areas of risk. There's about a dozen or so silos of risk management that exist in a health system. And we began to consolidate them on the platform and extend the value to our customers. So
Interesting.
you're doing it for third parties. What about your internal risk? What
Uh-huh.
about your research process? What about
Hmm.
you're doing M&A, you're acquiring maybe new hospitals or new assets. You have to go through a risk due diligence process there. So we began to add additional features and functionalities, and we curate all this content on the platform on behalf of those providers, and then we provide some really interesting value back.
Huh. Interesting. That's quite a neat. And how was it that you guys or yourself, like how was it that you originally kind of came up with this, what you guys are doing now? Because I know you did mention that you kind of struggled with this before, and then maybe that led you down this path. But what was it that sparked this journey for you?
Yeah, so it was just that, again, as a vendor to a hospital or health system, we went through this process and it was highly inefficient from our perspective.
Yeah.
And so when I reached out to the providers to find out, okay, what does it look like on your end? It was clear that there was an opportunity to drive
Yeah.
automation and do it in a way that was unique, not do it with a what they call a pipeline-based application, which
Yeah.
is, a single application that's great for my environment, but I don't get any leverage across a community. And
Yeah.
so this idea, this is really the unique differentiator we bring, is we architected this notion of a two-sided, which has now grown to a multi-sided network, where we can take the data and share it back to the community based on the capabilities within the system.
Nice. And so what are some, maybe, like, I know obviously you don't have to expose any type of, customer name or client names, but what are some examples of maybe, success stories that you've had with maybe some of,
Yeah.
clients using your products before and after type of thing?
That always bothers me when vendors will market, a large hospital in Western Ontario or something crazy like that, right?
Yeah.
Like, if you can't put the name of your customer up there, then you really don't have a customer success. So I'll talk about our customers. We have them on our website.
I love
We've
that.
done video recordings with them. They tell their story because they get amazing benefits from our relationship and the usage
Yeah.
of our product. We're
Yeah.
really proud and humbled to have the customers we have in healthcare. And again, before I get into, the case study, the interesting thing about healthcare that you don't get in other industries is this shared mission, right?
Mm.
We're all in it because of patient care and
Yeah.
patient delivery and care delivery. And
Yeah.
so everybody has been or knows a patient, whether it's your mother, father, sister, brother, aunt, uncle, brother, friend, whatever, cousin, relative, it doesn't matter.
Yeah.
Everyone's been a patient at some point. And
Yeah.
imagine a family member or a loved one is hooked up to one of these devices and it gets hacked.
Mm.
It becomes a personal mission now. So we should all be vigilant and digital and have the right level of diligence as it relates to cybersecurity and
Yeah.
technology. It's a real problem. And
Yeah.
we've seen it. We've seen it ransomware shut down hospitals and divert care. Imagine you're in an ambulance, you're going to a hospital, it gets hit with ransomware, and now you're diverted maybe 50 miles out and you're having a heart attack.
Yeah.
Time is muscle, time is heart muscle in that case. So,
Yeah.
like, it's a real problem. So, take Intermountain Health is a multi hospital system in a payer in Utah, Salt Lake City, and they service a couple of different mountain states in the area. And they came to us early on. We were started out on this journey, and they were doing this process. They had a lot of people doing the process, and they felt like there was a better way to do it. And so initially, they wanted us to be able to take 50% of the resources and redeploy them into other areas.
Mm.
We basically took close to 80%. We were able to
Mm.
help them redeploy those resources into other high value areas in cybersecurity and increase the volume of assessments and other risks that they were able to identify that they were
Oh.
managing. Remember, I mentioned those earlier, those silos of risk. They were
Yeah.
managing in other systems. They were able to consolidate it on the platform and save a lot of money and effort over the
Huh.
long term. So, yeah.
Wow. Yeah. And it's one of those things where, to your point, I love what you bring up is, if you can't name your customers, if you can't actually talk about your customers, are they really case studies? And it's a great example. And I love the approach that you guys have when it comes to that. And the fact that you even say that goes to show that you go above and beyond, right? When it comes to customer journey and customer experience. That, I think, at the end of the day, that's what's most important in any
You,
company, whatever you're doing, right?
you,
That has to be the focal point of everything.
you have to. And in healthcare, I mentioned the difference earlier. This is the thing most people don't understand about the healthcare industry. They always say, well, we service all these other industries. We're just going to create a vertical and we're going to change our messages around, maybe add some features in our product. We're going to go sell to healthcare. And that may be necessary, but it's never sufficient because what people miss is that shared mission.
Yeah.
And so what we do is we give back as much as we take.
Yeah.
So we donate our time to public-private partnerships through the HSCC, the Health Sector Coordinating Council, which is agencies within the government, as well as health systems and third-party vendors like ourselves, who are creating tools and helping shape policy around risk management and cybersecurity in healthcare.
Yeah.
And so that's a completely voluntary thing that we do. We also give back the industry a service for benchmarking. So
Mm.
any health system, regardless of whether they're a customer or not, can participate in our annual benchmark study. And they get full access to the platform and they get not only to see where they are in their
Hmm.
overall healthcare, cybersecurity, and risk management program, but they also get to compare their progress and their results
Yeah.
against their peers. And
Oh,
that's huge. And that's we give that back to the industry, no cost.
wow. And yeah, and I love that. And so, and you, like you said, it seems like you guys have this mission, which I feel like is always, you know, when it's beyond just the product itself, but it's something that you guys are actually impacting, and like you said, you're saving lives, right? Obviously, that's what this mission is about, right? Like you said, protecting the patients, protecting people from being in vulnerable situations that they don't need to be in, right? And so
Exactly.
it's one of those things where it's like you guys, it's there's a lot more to building the company beyond just hitting revenue targets, beyond just growing. It's like you guys have something that you are working towards, which I can always relate to. And so I did want to transition just a little bit, Ed, and talk through, because I was looking at your experience, and it looks like you've been a marketing marketing for quite a while, right? It seems like that's kind of in your background, and you've had a couple of different experiences working with different companies doing marketing per se. For other founders or CEOs that are kind of tuning into this, like what have been some of the principles that of marketing that maybe you've embodied that really helped your company continue to grow?
Yeah, that's we could talk for hours on that. Yeah, wow, that's a big question.
Yeah.
Marketing is an interesting function and discipline because on one hand, and you have people that are responsible for elements of marketing like advertising, like trade shows or events, like content generation.
Hmm.
They might be doing marketing automations, right?
Yeah.
So, integration with Salesforce and making sure that they understand the funnel, top of the funnel, and all the requirements that come along with that role. You have sales enablement, which can be part of sales, can be part of marketing. You
Yeah.
have product marketing, which is very different than
Yeah.
marcom or marketing communications, right?
Yeah.
And so it's a really interesting discipline, and quite frankly, most people don't understand it.
Yeah.
Has been my experience. Most people don't understand it
Yeah.
because they think about it in terms of those silos, those vertical slices.
Hmm.
And the way I've always thought about, and again, not to toot my own horn, but the way I've always thought about marketing is it's much more horizontal.
Hmm.
It can't be one over the other. It's got to be the right balance of all these things.
Yeah.
You've got to do press releases. You've got to write white papers. You've got to create valuable content that those ideal customers that are on the journey with you and they're starting off in the awareness stage,
Yeah.
right? That they're going to actually respond to and they're going to look at and you're going to help them understand the problem that they're facing without
Yeah.
trying to sell them too quickly,
Yeah.
right? And then once they get into the consideration phase, you really got to understand, A, how do you trigger them to get there? And then what are those assets that you've got to create that makes sense to
Yeah.
take them again along that journey to decision, whether
Yeah.
they choose you or somebody else.
Yeah. Yeah.
And it's a really interesting process that, as I
Yeah.
said, multidimensional, multifaceted,
Yeah.
that, people talk about integrated marketing and ABM and all these things. And I just been fortunate enough. I didn't come from marketing. I didn't take marketing courses. Like I said, I'm an autodidact. I just learned about, I read books, talked to
Yeah.
people, made
Yeah.
my own, had my own perspectives on it. And I figured out early on that integrated marketing was the way to go. And this is before anyone was talking about integrated marketing.
Yeah.
And so you have to, and the other thing that I think helps a marketeer is empathy. And
Mm.
most marketeers don't have empathy because they've never sold. And
Mm.
until you have sold, it is very hard to have empathy for the sales process, let alone the rep that's in that process. So that's, I think, another thing. I was, again, fortunate to have sold when I was a kid. I told you about all those
Yeah.
jobs I had. Some of those were sales oriented jobs. And then when I had my first job, I ended up running sales at an early age. So and then you carried a bag and then I sold. So you understand the mechanics of the sales process, what works,
Yeah.
what doesn't. And I think, for any CEO founder, the number one job, and I didn't know this really until recently. The number one job is initially is you've got to be able to sell. You've got to
Man,
be able to sell.
hitting it right on the head. You're hitting it right on the head,
You've got to be
Ed.
able to sell your vision, right?
Yeah.
If you think about a CEO, CEO does three things: vision, culture, and the numbers, the money aspect of the business, right?
Yeah.
Those three things are really what a CEO needs to focus on. If you can't sell your vision in a way that actually gets people to come along with you, you're going to be dead. And you
Yeah.
cannot delegate that to somebody else. You can't hire someone to do that
Yeah.
because they're only going to build off of what you know and what you're able to teach them.
Yeah, and it's such a great point, and I don't think enough people talk about that, especially for the, technical founder base, right? The people that are more technical, they oftentimes try to outsource sales or outsource, the marketing elements, right? They don't want to. They're like, oh, I don't really like it that much, and so I'm just gonna hire it for. Which I mean, in some cases, you can kind of get away with in some capacities, but when it comes to the marketing and the sales vision, like you said, it's so important to have that baseline knowledge. And to your point, right? Like it's so complex, right? And I think a lot of times when I talk to founders is they think that marketing is this little box, right? It's like, okay, I just got to pull from like this box of Legos, and then if one of these Legos is gonna be the thing that grows my business. And it's like, no, 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 no. Like this is like you said, this is a process, horizontal. It's a customer journey. Are you building trust throughout your sales process? What assets are you giving them, right? Is it top of the funnel? Is it what type of content are you using at the top of the funnel? When they're at the middle and the bottom of the funnel, what type of content are you showing them there, right? And so it's a scientific approach to being able to figure out, how to optimize conversions, right? And then obviously how to optimize for trust because that's
Yeah,
the biggest thing, right?
and the trust thing is really important, and I'm glad you brought it up because not only is that sales empathy important, but the connection to what it is you sell is important.
Yeah,
And so again, most marketeers think they know what they sell, but they don't really know the product.
yeah,
And until you've run product management, until you've been in a product marketing function, it's really hard to understand how things get built and how things get deployed and how things get updated and how you translate vision into, in our case, into working software, right?
yeah,
And I think from again, very lucky, very fortunate, went from those early roles into a product role because I realized that I don't know what it was, maybe I intuited or something, but I remember thinking to myself, wow, if I was working for a car manufacturer, uh, I should be working on the car because, and I should know everything about the car because that's what we ultimately sell.
yeah,
So, how can you market something if you don't know ultimately what you sell at the level of detail? And most marketing people will stay in their lanes,
yeah,
and for whatever reason, they don't go outside their boxes. And to me, it's really important to gain that knowledge on the product side. And it's easy to do. Like if you're a product marketeer and you can't demo your product, that's bad. That's problematic. I don't even care if you don't
yeah,
have to give a great demo. You got to just be able to at least get 40% of the way there.
yeah,
If you can't do that, you don't understand your product. You truly don't because you don't know how it operates, right? So that connection with sales and product
great
from
point.
a marketer's perspective is so damn important. You,
Yeah,
you got to have
yeah,
it.
yeah, yeah, yeah. And so I guess, on that itself, right? Like, what would you say is like some advice that you would give, to like, say some founders that are looking to like kind of get their hands more dirty into the marketing, and even sales side of the business.
Yeah.
What would you tell them? Like, what are some actionable steps that maybe they can take to start to learn the right things to do?
Yeah. Great question. And I laugh because it's a longer conversation, but think about it this way. Technical founders usually are engineers
Yeah.
in my industry, right?
Yeah, definitely.
So they engineer software, hardware, or something in
Hmm.
between. So think of it as an engineering problem.
Mm.
So so for Sense, I'll give you some examples. At Censinet, I came at the formation of this company with obviously the intent to take my vision and create software and sell it, right? And all that other good stuff. But
Yeah.
more importantly, I also wanted to look at those functions and
Hmm.
those things that I've seen done well and done not so well in
Yeah.
previous lives. And
Yeah.
this
Yeah.
is just one example. But when I talk about engineering, so I thought about engineering the organization in a way that removes a lot of the silos of
Uh-huh.
friction that we create for customers,
Mm.
right? Think about it. So here's an example of one. People typically have support, they have services, they have account management, they have customer success, they have maybe renewals, expansions, whatever, right?
Yeah.
Sometimes those functions do multiple things, sometimes they don't. Those create points of friction from the customer,
Yeah.
right? The customer has a problem, they go to support. Customer has a problem or needs a solution, they go to services, right?
Yeah.
By the time it gets to product, it's diluted.
Yeah.
Too much noise in the signal.
Yeah.
Product, again, is the lifeblood of the company. They need high fidelity.
Hmm.
You want to get rid of the noise. You want to get the problem sent to product as quickly as possible so the product team can figure it out.
Yeah.
What do we do to solve the product? Versus having support keep adding tickets, right? What support should be doing is looking at the 5 root cause issues that cause 80% of the tickets,
Yeah.
give them to product, and product can fix them. Or
Yeah.
services. We shouldn't be creating, large services organizations because they're expensive as hell. They bring margin down, which you
Hmm.
can reinvest into the business. What you really want to identify is what level of services is needed
Mm.
to get customers successfully deployed,
Yeah.
adopted, and also ultimately buying more from you over time based on that trust relationship you talked about, right?
Yeah.
And so services teams are incented a little differently, right?
Hmm.
They get incented by utilization rates and
Hmm.
obviously profit margins, right? And the amount of business they sell, right? And
Yeah.
so they don't get incented to give product root cause issues that they're fixing and solve them in product.
Yeah.
You see where I'm going?
Yeah.
So we took a very unique look at the problem and we
Hmm.
began to architect organizational structures and functions a little differently this time around.
And that's the way to do it, right? Like you said, it's a very systematic. It should be approached very systematically in that fashion, right? When it comes to where are you looking to optimize, right? And what part of your process is broken, right? Because that's the part that you troubleshoot, and that's the part that you can figure out how can I test different things, right? And I mean, I'm sure you probably have some sort of passion in there as I do, right? Like that stuff to me, I geek out over. I'm like, I love diving
Yeah.
into the process side of things and figuring out what's broken, right? Like looking at the data and being able to troubleshoot. Okay, well, what if we test this different hook and put this here and put that there, right? And then you just are testing all your different hypotheses for what you feel like might help. Once you find it, then it's just a rinse and repeat, right? And that's the
That's right.
beautiful
And
thing.
adjust accordingly along the way. You're right. Absolutely.
Yeah,
Absolutely.
yeah,
And and a lot of people that's that's change. That's transformation and it scares a lot of people. They don't want to change. They want to
yeah,
it's too upsetting. It's too scary. It's too unknown.
yeah.
And I think as an entrepreneur, you have to sort of embrace that. If you
You
if you
have to
don't
be.
love, if you're not a change junkie, a transformation junkie, you probably shouldn't be a CEO.
I agree.
Um,
You have to be malleable, right? You have to be able to
yeah,
to be fluid, and I couldn't agree more.
yeah,
Hey Ed, it's been a pleasure getting the chance to hear a little bit about your journey,
yeah. You
man,
bet.
and really dive into the marketing side of things. I definitely think that this one's a valuable one for people that are looking to take away how you can start to market your business better, right? And I think you laid out some great actionable steps for that specifically. Now, in terms of what you guys are doing, and if people want to get in contact with you, like
Yeah,
I know you also have a podcast, so feel free to
yeah,
like plug anything here or tell people where they can go ahead and find you.
yeah. I wrote a manifesto when I started the company, and I was trying to personify risk in a way that made sense to people, and so.
Yeah,
I told you that story about, if your brother, father, sister, mother hooked up the machine, right? It's personal.
yeah,
And if you think about healthcare in that context, healthcare is 24/7.
yeah,
And so if it's 24/7, that means people are working around the clock, which means if there's people and there's machines, there's always risk. So
Yeah.
risk never sleeps
Yeah.
became this concept, this moniker, to really personify risk in a way that was really, people started to think about, oh, it's so true. Risk never, it doesn't. It's
Yeah.
always on. So you need a process that can keep up with risk in that way, that can change when scope changes, that can change across this life cycle of the relationship you have with the vendor and the product, that
Yeah.
can change based on your changes at the organizational level, right?
Yeah.
So that became sort of the designation for the podcast. I thought, oh, Risk Never Sleeps. That sounds like a cool name for a podcast.
Yeah.
Also, it's the name of a favorite album of mine. Neil Young and Crazy Horse has
Hmm.
a record called Rust Never Sleeps.
Huh.
So I kind of named it after Rust Never Sleeps.
Yeah.
Risk
Yeah.
Never.
Yeah. 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 Little
And
inspiration. Love it.
the reason I did it was because, quite frankly, I felt like there were a lot of podcasts out there that were technical but not conversational,
Yeah.
not an opportunity to get a chance to know the person behind the role.
Yeah.
And so my podcast really focuses on the person. And I'll ask questions like, if you could go back in time and talk to your 20-year-old self, what would you tell him or
Hmm.
her?
Yeah.
You're stuck on a desert island. What are your top five records you bring with you, or five movies?
Yeah.
Like, questions like that. Like, what's the riskiest thing you've ever done? Which is a great question.
Yeah. Yeah.
But it's the personal aspect that, you know, years ago, it was unnatural to be authentic.
Hmm.
Years ago, you couldn't be authentic. You had to manage this duality of work person
Yeah.
and home person or
Yeah.
life person. And now society's changed in a way that authenticity is rewarded. People want to be authentic,
Yeah.
right? We crave for authenticity.
Yeah.
And
Yeah.
so so on a podcast with that sort of backdrop, you can be yourself. We get to see the authentic self.
There's nothing better
And
than that, right? I think that's
yeah,
what people are starving for,
I think so. Yeah.
especially with all this AI stuff that's coming out as well. So
Oh my God.
I agree. I couldn't agree more, man. But hey, man, thanks again, Ed. So
Yeah.
so Risk Never Sleeps. That's the podcast. I'll make sure
Yeah.
to plug that in. It's there as well, and then put in your LinkedIn profile. You active over there? Can people go ahead and find you there?
Yeah. Ed Gaudet. So it's just Ed Gaudet, linked slash LinkedIn, right? Whatever the
Perfect.
URL there is.
Yeah, yeah, yeah.
Connect with
I'll make sure to
me.
include those in the description along with the website
You'll
itself.
see my handsome face on that LinkedIn. Just connect. I'll connect back with you. I'd love to connect with
Beautiful.
you.
Well, make
Yeah.
sure to go check out
All
Ed
right.
and the team. Definitely sounds like they're doing something beautiful, and I love the mission and what they stand for. So, if you guys did make it all the way to the end, make sure to like, comment, and subscribe for more content. Ed, thanks again for coming on. It's been a pleasure.
Thank you. Thank you.
Alrighty.